alaikum wa rahmatullahi wa barakatuh. Peace be upon you and Allah's mercy and blessings too. Welcome to your Wellbeing Matters Public Health Hour with me, Nazira Vania. I'm a project manager for Community Wellbeing Champions in Public Health at Leicester City Council, and I have the honour of bringing you this series on the important health and wellbeing matters for the city. Thank you, dear listeners, for joining us today on Ramadan Radio 87.7 FM for what is the fourth, and I'm really sad to say, final show of the month. I pray it has been of benefit to you and yours, inshallah. So far, we've discussed physical and mental health and well-being, fuel poverty and the cost of living crisis, and measles, the MMR vaccine, and the importance of health protection. Those were all big topics, but today we're going supersize, as we'll be talking about the big picture in public health with some very special guests. We've got our Director of Public Health at Leicester, Rob Howard, and Consultant in Public Health, Mary Hall. We've also got apologies from Browne, Professor Ivan Browne, who was our director before Rob and is now at De Montfort University as a professor in public health. He unfortunately couldn't make it, but we've got lovely Mary in his place. Thank you for stepping in, Mary. So before I welcome them properly to the show, I'll just take a moment to remind you to grab a pen and paper or have the notes app ready on your phone, as we will, as usual, be sharing lots of information that you might want to jot down for yourself or someone you know. I'll also just remind you just how you can get in touch with us, as we'd love to hear from you. So if you have any comments or questions, you can send them to the studio on 0774 8855055. That's 0774 8855055. So that's via text message or WhatsApp. You can pop them into the chat if you're watching online, or you can call the studio on 0116 4822 That's 0116 4822 So on we go to our show and our guests. Welcome, Rob and Mary. How are you today?
Very well, thank you. Really nice to be here. Thank you for asking us.
I could see your people of experience when it comes to this, because our previous guests have looked a little bit nervous, but you guys look very much at ease.
You're just saying that we look old, aren't you? That's
No, not at all, not at all. So no, it's not good to insult your guests from the outset, so apologies. So normally I would ask you, as our guests, to tell us a bit about themselves and their roles at the start of the show, but I think what we're going to do today is just do it a little bit differently, because we'll learn about you as we're going along, because we're going to be talking about careers, roles, etc. And I think, that's where we can really kind of delve into that. So what I am going to do is actually, I'm going to test you in the back to basics, which we usually do, but it helps to have a few definitions at the beginning to really understand what is it we're actually talking about. And the term public health, we've used it a lot, but actually what does it mean? What is public health, and how is that different to the NHS?
Shall I give you the classic definition?
Yes, please.
It is a good test. You need to, when you do public health exams, you need to have remembered this.
Okay.
So it's the classic definition, which was actually from over 100 years ago, was that public health is the science and art of preventing disease, prolonging life, and promoting health through the organised efforts of society.
Okay.
Now, there's lots of in that. It's a short statement,
yes,
but there's lots of things.
So unpack it for us.
First of all, it's a science and an art. So often people think of public health, we're the kind of geeks that do all the data and the number crunching, and also what we call epidemiology, which is the science of looking at diseases in populations.
Okay.
Now, that is the science bit. It is really essential and it's really important. But if you only do that, you don't get anywhere. So the art of public health, the art of communicating, the art of persuasion, the art of working in partnership, these are absolutely essential.
Yes.
So that's why I really like that definition, because it incorporates both of those things.
Yes.
And then the second bit that's really important, as well as including a lot of the things you've talked about, and I was really happy when you did the health one that you talked about, physical and mental health, as being both equally important. And that's absolutely true. But it's also about the organised efforts of society or the community. And again, that's a recognition that we can only do things with our communities.
Yeah.
So that's why the work that you're doing here today is an essential part of public health. It's about communicating, it's about talking, and it's also about listening to people as well.
Yeah.
And that's really, really vital. So that's the
Public
classic definition of public health, and the science bit is what you do hear the term epidemiology.
Yeah, and I guess that's the kind of, I don't know if it's a strict distinction between public health and sort of general health, but the idea that you're working with the population community at that level, whereas the NHS GP, that's individual health in a sense. Is that a useful way of thinking about it, Mary?
On this bit I'd like to quote my friend's daughter, who was probably 4 or 5 at the time, and her dad was a GP and her mum was a consultant in public health. And when somebody asked her what her parents did, she said her dad helped people when they were sick, individuals when they're sick, and her mum stopped the population getting sick in the first place.
Okay.
And that's what we'd say the difference is with what Rob was saying about the population aspects of public health and that prevention aspect of public health, stopping people getting ill, understanding what causes illness and sickness and doing something about it before it has an impact on people.
Brilliant. Thank you. So that's a good grounding then. So we know what we're talking about when we're talking about public health. My next question is, why is public health sitting with the council instead of, in a hospital or with other health services? What's that about?
I mean, that's a very interesting question, and that did change back just over 10 years ago, because public health used to be part of the NHS.
Okay.
At the time, it was this thing called Primary Care Trust, which some people will remember, now called the ICBs. But they are you okay?
If you just put the mic a little bit closer to you, so we don't lose you.
I can hear it slightly because we'll carry on. So there was a decision taken to move it into local authorities. It could really sit in either place.
Yeah.
But for me and for my background, which we'll maybe talk about later, it made perfect sense to move into local authorities because a lot of what determines people's health, good health and bad health and their outcomes, are the circumstances in which they live. So where they're born, the housing that they live in, the air that they breathe, the food that they eat, where they can do physical activities.
Yeah.
All these things, we often call them the wider determinants of health. And they are really, really crucial. And that essentially is what local authorities do, don't they? They create places for people. They have a role in housing, they have a role in waste, in green spaces. And so for actual public health, in fact, a lot of people said public health was coming back home when we moved into local authorities because, 100 years ago, it was based in local authorities and the chief medical officers for each area were based in local authorities as well. So we have kind of come home to local authorities in that way. But it's really important that we work across both the NHS and local authorities and also in the voluntary and community sector as well.
Yeah. And I think you've touched on it there, but what are some of the things people might see or experience in their day-to-day lives that are examples of public health in action? So what are the things that people might not realise are actually there's public health happening here?
So we have things like physical activity classes and steady steps to help people prevent falls in older people who might be vulnerable to falls, smoking cessation and access to quitting smoking. We have drugs and alcohol. We commission the local drugs and alcohol services.
Right.
We commission the Healthy Schools programme.
Okay.
There's loads. Yeah. I could go on.
Yeah.
I mean, some of the things we do, which you might traditionally think is public health, is things like, for example, the fuel poverty programme that you had on the programme 2 weeks ago, or whenever it was. Which is, although that kind of seems to be about energy and fuel bills and housing, is a really, really important part of public health, because if the home that you're living is cold, it's got damp, it's got mould, as well as the impact on your mental health, which is, it's horrible to live in a house that's got mould on the walls. It's also really bad for you physically as well. It contributes to cardiovascular disease and respiratory ill health and so on. So that was an example of a programme which we used NHS funding, which was there to tackle inequalities, to set up that fuel poverty energy advice programme. And that's actually my history, which we might talk about, but that's my history, was working in those kind of areas as well. So for me, that's a really important part of public health as well.
So we'll learn more about that later. But again, that's that sort of relationship of the NHS funding something in that prevention stage, so that there's less sick people sort of coming through the doors in that needing treatment and support stage, isn't it?
Yeah, absolutely.
Yeah. Okay, so that's our background to public health. Now we're going to talk about vision and priorities. And Rob, I'm going to come to you because you're now about 6 months in the hot
just,
seat.
I can't believe it. I can't believe it's been 6 months, but it's gone
as
very, very
director,
quickly.
So what is your vision for public health? What's the aim?
So obviously I took over from Ivan, and Ivan led the city through the COVID pandemic, and the whole team, public health and the whole council, worked really hard with Ivan. But Ivan was such a superb figurehead, so it was quite daunting to take over from Ivan. But we actually did some work as a division only about 18 months, 2 years ago, to look at, as we're starting to come out of COVID, what is our vision for what we do, what we're trying to do in the city. And it was really about, I've got it written here, it was about, our vision was to strive for a fairer Leicester in which everyone can live healthy, fulfilling lives. Right. So it's a grand old vision, that.
It is. Really big.
But really big, but nice and short and concise. But the ways that we do that is working across all what we call the different domains of public health. Yeah. So part of that is about health protection. So this is what Mary leads on. She might talk a bit more about. It's not just the measles that we talked about, but all infectious diseases. It's about all the screening programs for bowel cancer and those kind of programs. All that health protection stuff, like we did during COVID. That's one of them. The other bit is about the kind of what you might call the lifestyle stuff around making sure people eat healthily, that they stop smoking, that they get enough physical activity, all those kind of things, that they're not lonely. Even something like that is really important for health. So that's really important as well. And then the third bit, which probably doesn't get as much attention, is that we work with the NHS to make sure that what they're doing first of all is really effective and works, but also that it helps to tackle the really huge inequalities that we have in the city. Yeah. And we do have huge differences in life expectancy and how healthy people are across the city. And we can only tackle that by working with the NHS, with the voluntary sector, with other partners as well.
So that's inequality for Leicester compared to the rest of the country. There's ways in which we're worse off health-wise, but then there's the inequality within the city, your different neighbourhoods, your different postcodes.
Exactly, and there's the life expectancy differences just within the city is between kind of 10 and 12 years difference between the the kind of the wealthiest areas and then the poorest areas, which always have the poorest health as well. And so that's, for me, is why I went into public health. I went into public health to tackle inequalities. And so my vision for how we work is to absolutely focus on tackling that and make sure that we put the resources that we do have where they're most needed.
Yeah, thank you. And so that's the kind of the big vision. And in terms of specific priorities, because we've over the last 3 weeks we've heard about 3 of the big priorities: the mental health, physical health, fuel poverty, cost of living, and the current sort of increase in measles and importance of vaccination and health protection. So what are the other kind of outside of if we call that a top 3, what's the top 3 outside of that?
I'm sure we can do one each and then think of the third one, can't we? So do you want to go first, Larry?
Yeah, well, as Rob said, my lead is health protection. So we've covered that a bit in measles, but it's not just about infectious diseases, it's also about prevention of infection and controlling infection. So we have we work closely with our care homes, for example, in making sure their standards are up to a certain level to prevent spread of disease and infection in the care homes. But also, I think over the last couple of years, drugs and alcohol has been at the top of the agenda, particularly locally, but also nationally. There was a big review 2 or 3 years ago, which then led to an injection of quite a large amounts of money into areas where the need was highest. Leicester is one of those areas. We know we have, although we have a large proportion of our population who don't drink alcohol, for example, our alcohol-related harm is at the very higher end compared to the rest of the country. For those who are drinking, So you would have thought overall Leicester would have a low level of alcohol-related harm, for example, because we have such a high level of abstinence, but it's not the case. Just illustrating the massive amount of need there is. Yeah. So we've been able to work with our treatment provider. Turning Point is our main treatment provider, but we do work with other providers as well, and to really look at what we do in drugs and alcohol in terms of treatment, but also raising awareness and making sure some of those services reach communities that might not otherwise have reached out to the services. So making sure we go out to the communities and making that across a whole of Leicester, not just for those able to come into the service.
And other conversations we've had in the office, we've talked about screening, and would you say that's up there as well in terms of?
For me, really screening is in my area, so I'm always going to go, screening.
And screening for what?
So screening, we talk about the main cancer screening programs, so that's bowel cancer, breast cancer, cervical cancer, but there's also other screening programs which you might hear something called the AAA, which is the aortic aneurysm, which is a swelling in the aorta, which can happen in older people. So that screening is targeted particularly in men over 65 because that tends to be where those issues are. And then particularly pertinent for Leicester is diabetic eye screening as well, which is an annual screening programme for people with diabetes, and it's really important to go and make sure their eyesight is good and healthy, as that is a risk with people who've got diabetes. But the cancer screening programmes, we don't do very well as a city in terms of our uptake. We're around 50% of our population who are eligible. So different people are eligible for different screening programs, depending on what the screening is. But across all of them, we don't do very well at all. And these are a really good way of looking for early signs or early changes that might indicate cancer at a later stage. There'll always need to be further tests or in the screening, but they are a really good way of looking for early signs and doing something about it early. So we treat people early, then the outcome for cancer is really good. And we know, for example, our bowel screening programme, again, it's in the 50%-ish region, but our survival for colorectal cancer is very, very poor. We've actually got the worst survival in the country. So it's not just down to screening, it's one part of the whole, but it's an important part.
Okay. So if there's a key message, a takeaway,
if you get today, your letter, you will get
your
letter.
Screening letters, or someone gets theirs. Make
really
sure
go
they
for
do
it. And
take that up.
And you will get a screening letter, an invite to go screening depending on your age, and male and female will have different, obviously breast screening or cervical screening. But if you get that letter, or if you get that invite, or a member of your family has had that letter, it's really important to go. It can be, going for cervical screening can be a little bit embarrassing. It's a really short, quick test, and you can ask for a female to carry out the test, for example, if you'd prefer that. And there's a whole load of way to support you having that test, but it's really important. Get the letter, go along.
Okay. Rob, do you have another priority to that?
I will, but I'll just also say that, we do acknowledge that going along for these screening tests, it's often people have so many competing priorities. They have busy lives. There's lots of stresses and things happening. And it's easy just to say, I'll do that another time. I'm going to forget about that now. I'm probably fine anyway. But actually, it's really important, and it can literally save your life. That's the important message. And yes, sometimes they're slightly uncomfortable, doing the bowel screening one. Everyone, it's a bit ucky, isn't it? But it's as much of a health protection team, and we got Mary in during COVID, and Mary has now set up a team of people working with the NHS on these issues. So that definitely highlighted the specific role that public health and local authorities has in this area. And certainly working with our community wellbeing champions. I mean, that started off as a vaccination champions program, as you know, because you run it. And it's a fantastic program. And I think us seeing the impact of that on vaccination rates and our ability to listen to and talk to communities, that really made a difference. So that's an absolute priority, and we will continue with that. I think the one thing that we haven't mentioned that we're going to put a lot of emphasis in this coming year is stop smoking. So the government has actually announced this new legislation for smoke-free generation, which, if it all goes through, and we're all hoping and keeping our fingers crossed that it will go through, will mean that anyone who's currently 15 will no longer be legally able to buy. Is it 15? I think it's 15. Will no longer legally be able to buy cigarettes ever in their lives.
Wow.
So this is a way of actually completely, almost eliminating smoking tobacco entirely. And as a result of that, they're giving us additional money to increase the size of our stop smoking service, kind of doubling it.
Right.
So there's loads more work, and people are going to be probably sick of us banging on about getting people to go along to stop smoking services. But we can offer support. We can offer nicotine replacement, including vapes and patches and all those things.
Yeah.
And we have a really good success rate of helping people that do smoke stop smoking.
Yes.
And let's face it, most people who smoke want to actually give up.
Yes.
They know it. They know it's how bad it is for you. You know, it's how bad for your family.
Yeah.
And most people want to, but it's, it can be hard. We can guide you through that. We can offer all the help that you need, and we have a really good success rate.
The support's there, and it's free.
Is there, and
so
it's absolutely free.
Get in touch.
Yeah, absolutely.
Okay. So I'm going to pause there just to remind everyone they can get in touch. So the WhatsApp and SMS is 0774 8855 That's 0774 8855 And to call the studio is 0116 4822 086. So that's 0116 4822 086. Actually, you mentioned communities, and that's probably a good time to kind of go on and talk, because when you're deciding priorities, it's probably informed by a number of different things. And we were going to talk about research and communities. And I think they do kind of go together, because it's all about information, insight, data that you need to make the right decisions and decide the right priorities. So if we start with research, actually, what role does research play in public health?
I mean, research is absolutely essential. And it's a really big part of our training is to understand different research methods, understanding how to look for the evidence for what works. And so we're really keen to actually stay part of the research agenda, which is why we have really good links with both Leicester University and De Montfort University in the city. And in fact, as you said, Ivan Browne, the former director, is now Professor Ivan Browne.
Yeah.
He's now Professor of Public Health, and I think it's Public Health and Wider Determinants of Health at De Montfort University. And we've been talking to Ivan about how can, because a lot of research goes on with second year students in universities, and they don't really represent cities like Leicester.
Yes.
So we're saying, how can we get, first of all, people in Leicester involved in research, so that when they're looking at what works to help people stop smoking or take up bowel screening or whatever it is, they're using people that most need it from our communities in the city.
Yes.
So we're looking at how we can better make those links in that way.
Yeah.
But also, how can we have conversations with universities to actually influence the agenda of the things that they are wanting to research? Because often that's driven by national agendas or by what the drug companies want to test. We want to do it the other way around and say to our communities, what's important to you?
Yes.
What is it that you think is missing? What more would you like to know about your health, your well-being? And actually feed that back to the universities and say, these are the sort of things for our communities that you should be researching. Yeah. And this is how we could do it, and we could work together to make that happen.
Because that community involvement is really important, isn't it? So before us, there was a program about dementia, and counsellors of our Hook was talking about, they were talking about kind of clinical research, and there really is a gap there, isn't there, where currently research isn't really reflective of populations, so there isn't that diversity there. So what could, how do we change that?
I mean, at the moment, the National Institute for Health Research has recognised that and put a big funding package together to ensure that is better represented of the communities the research is being carried on. And as Rob said, we have close links with our local universities. It's really difficult, isn't it? Because they're kind of words and not necessarily meaning. And I suppose it's over time and getting people involved and building up those relationships and saying what's available and what's out there. We often get different universities from around the country contacting us because they want to carry out a research project and they need a diversity. So they'll write a program and then they'll get in touch with us and say, can you say that you like this program, please? And it's actually, we've become quite firm on that and saying, actually, no, we're not here to be your subjects. We're here to actively participate and actively be involved together, but not we just come in and you get what you want and then you go away again. It has got to be very much in conjunction with us and within our communities and working together on that.
Yeah. So if we talk about that community engagement now, and obviously, I've been plugging the Community Wellbeing Champions Network in every program anyway. But if you tell us about it from your perspective, Rob, and what public health, what that relationship is with communities and the community organisations that support them.
Well, I've seen firsthand the difference that your program has made to us in public health. It's been a fantastic example of how to work and be led by communities and all the diverse communities across the city, which is, makes Leicester the fascinating and rich city that it is. Yeah. And actually having that network of over 100 different organisations from different communities, for me, it's not about us having the route to tell people what to do and how to be healthy. For me, it's about us having a route to be able to listen to people and actually understand what their concerns were. And like when we were concerned about the uptake of the COVID vaccination, for example, in certain communities, when we set up this program and went out and listened to people, and we got really practical things that people were concerned about that they wanted to know about. And we were then able to listen to them, provide reassurance, and even if it was things like going to people's places of worship or to their community centres and offering services there rather than expecting them to come to a GP surgery. Little things like that can make a massive difference and did make a difference. Yeah. So it's really an approach for me rather than a particular theme or a particular topic. Yeah. It's about how we do everything in public health and how we can use that programme to improve everything that we do in terms of listening, understanding people and then reaching them with our services. Yeah.
So we heard a little bit about that last week. Mary from Laura and Maddie, who are in your team, and what they're doing in communities to understand what the barriers are to getting vaccinated, getting the MMR vaccine. So, and that's the thing. Whenever I describe the Community Wellbeing Champions Project, I talk about understanding communities' needs and the barriers that stand in the way of having those needs met, because it's what is feeding the inequality. And how do we understand how that's being caused and then know how to address that, isn't it? So can you tell us a bit more about that, Mary?
Yeah, absolutely. So the COVID work that Rob's just mentioned is a really good example in which we've followed through with the measles vaccination, and the big outbreak of measles we have at the moment is understanding why people aren't getting vaccinated with measles. And we could all sit around in a room and come up with loads of ideas and think we know best because we're the professionals. Actually, we know not at all, and we'll come up with reasons as similar reasons to what Rob was saying about, it's great, I need to take my child to have my MMR vaccination, but I've got 3 other children and we're back from school and we haven't got time and we're doing this, and if you come out to us we can get vaccinated. Or if I can just ask this question, then I'm okay now, I'll get my children vaccinated. So things like that, as I say, we can sit around in a room and think we know. Now we don't know at all. We need to go out and find out and ask questions and understand from the people who we're wanting to be worked with. I just wanted to add on about the research and the link with the communities as well. After COVID, it was a really good example of wanting to have an opportunity to hear the voices of our community and what COVID had meant to them, particularly in Leicester, had a really, really different experience to the rest of the country. So we worked with the University of Leicester to run a research project to go and speak to the community and say, what did COVID mean to you? How did it affect you? How did it impact you? And all of that work now is on the National Archives to stay forever, just to reflect the voice of the people of Leicester and what that meant to them, which is, I think, really important.
And that voice is really important, that lived experience, that's what gives you the really kind of rich insight, and that complements the data, the high-level information is also important. And then it's a really key part to this reaching communities is the community organisations, isn't it? Because for various reasons, the relationship might not be there between residents and like the local authority and other, the health services. But those trusted relationships are there with those community organisations, and we're lucky to have such amazing community organisations. So public health works very closely with them, don't they?
Yeah, I mean, when I first started, you took me out to a few of them. Just before Christmas. I was completely blown away by some of the amazing projects that we have in the city. even like the Centre Project,
Yes.
and we went out to Be Inspired and Browne, and I don't want to single in any individual ones out because there's
too many to name.
Because there's too many, and they were really, really inspiring. And what the voluntary sector does is it achieves so much for so little.
Yeah.
And it's really hard times at the moment. Local authorities have got no money, the NHS has got no money, and the voluntary sector is always the first to suffer. But it's really important that even though we've got little in the way of funding at the moment, that we work together as best we can to do our best for the communities of the city. Again, that's real part of my priority for the whole of public health for this year, is to continue that.
Yeah. Okay, so we're going to pause again there, and then we're going to come back to you, Rob, because actually that community background, that's where you're from as well. So it'd be lovely to hear about kind of each of your journeys into public health. So, but just as a reminder, if you want to get in touch, you can contact the studio on 0774 8855 or 0116 4822086. Also, if you want to become involved in the Community Wellbeing Champions Network, see my weekly plug, you can get in touch on wellbeingchampions@leicester.gov.uk. That's wellbeingchampions@leicester.gov.uk. So if you're in any sort of role where you're supporting communities, whether it's voluntary or a VCSE organisation, you're just a passionate individual and you want to be connected into public health and what we're doing and stay up to date and collaborate in supporting your communities, please get in touch. So wellbeingchampions@leicester.gov.uk. Right, so for the last part of the show, we are flying through this. For the last part, we're going to talk about public health careers, because wherever I've, usually at events, I've met at least one person when we say public health, and they just get really excited and say, I want to work at public health, how do I get in there? There's a real buzz about it. And people are really interested in what it's about and in working in public health. So if we could start with talking about kind of your journeys into public health, I'll come over to you, Rob. Why did you choose public health and how did you get here?
Yeah, I mean, it is interesting because public health, as you know, if you talk to people in our team, is very varied. People come from all sorts of different backgrounds.
Yes.
So there's no one route that you have to do to get into it, because it is a science and an art, as we said at the beginning.
Yeah.
So you'll have medics who come through medicine and then become consultants through that route. You'll have people who've come through community organisations doing campaigning or doing, self-help kind of work. You'll have people coming from all sorts of different backgrounds. Mine was, I started in Nottingham. I started doing welfare rights kind of benefits advice.
Okay.
This was the first job I did after I left university, and really enjoyed it, but it was really demanding, but also kind of saw those links between the stress that people were under when they couldn't afford the bills and they were getting behind in the rent and all those kind of things. And that started a little thing in my head about that link between health and deprivation and poverty and inequalities. And then I got a job working for NEA, who we're now working with again on the fuel poverty programme, doing which is a fuel poverty campaigning organisation, campaigning for warm homes, essentially. And I ran lots of projects around the country. And at the time, my children, I've got 2 daughters, and they were quite small, and they had asthma, and my wife got asthma. And I started getting interested in the relationship between cold homes and damp and asthma. So that led me on this journey into this thing called public health. And as a result of that, I ended up giving up quite a good job that I had to start on a training program to become a public health consultant. Right. That was quite late in my career. I was in my 40s when that happened, so you can come to it, quite late in your career as well. And it was the best thing I ever did, because it's such a fascinating topic. It's so varied, and it just tends to be that great people work in it as well.
It is.
So
one of the most positive places I work. The energy is always really up. Mary, was your journey similar to Rob's, or is yours different?
Slightly different.
Okay.
Yeah, I started off as a nurse originally, and then I went travelling around the world, and after that I worked, and then I probably worked overseas for the next 10 years or so in different parts of East Africa, so Uganda and Somaliland, and then Yemen, Sudan. And then when I came back, I worked in the voluntary sector for another 10 years or so, supporting other voluntary organisations to get funding, to set up, to get volunteers. So that link with the community and voluntary sector organisations is a real core through my job. And then somebody said to me, "Oh, you want to do public health?" And I was like, "I don't know what public health is." Public health? No idea about what public health. And then looking into it in more detail was kind of, oh yeah, no, my whole career has been around public health. I just hadn't realised. And then did the same training programme that Rob's spoken about, and then became a consultant through that. So that's a 5-year training programme.
Right.
There's a national recruitment every year, which opens in November. So if anybody's interested, just Google public health consultant training. And I'm part of the recruitment panel for that. It's a national recruitment programme, so you get applications from all over the country, and it's absolutely fantastic to see that massive variety in experience. We have scientists, pharmacists, physios, nurses, voluntary sector organisations. So anybody can apply. You need some
There's
experience.
no sort of prerequisite to having had.
You do need to have a degree or and some experience, some work experience, but it doesn't matter what that is as long as it's related to public health in some way. And as I say, I didn't even realise I was working in public health until I sat down and had a really good look at it. And it's the same within our team. We have people with huge around different variety of background.
Yes.
It's kind of an open door, isn't it? Public health. You get in, and then you get sucked in, and then you realise it's so fantastic and so enjoyable and so varied and so very different. You're there. You're stuck once you're in there. You're never going to go.
I spent about 10 years in sort of community safety, crime, antisocial behaviour reduction work, and then 5 years as a children's social worker. And it's after coming into public health, I reflect back and think I was doing public health all along.
Absolutely.
So you really can come from a wide variety of backgrounds to it, really, can't you? And it's also an organisation that, like, it's one of the most kind of learning positive organisations as well. There's always lots of encouragement once you're in to develop, to learn, to progress.
And if you go back to what Rob was saying about the science part of it, there's always, we have regular journal clubs, for example, but there's always things that we're always developing and wanting to improve and learn about. The evidence always changes. It's always good to know what the evidence is.
I'm being a proper poster girl for public health right now,
because
I really do.
It's really
it's a great
easy,
place to work, and I'd love
to
see kind of just more people and more people from the communities that lots of people are there wanting to help their communities as well. So it's great to see that kind of come through. It's talked about kind of like how diverse the backgrounds can be in terms of coming into public health. Tell us about the diversity of the roles. So once you're in public health, what are the kind of things you can do? What are the settings available for practicing public health? Because it isn't just about public health in the formal sense of being in the local authority, being in the council.
No.
Where can public health take you?
So in with the name public health on, there's probably there's roles without, but just to reflect again on all of our journeys, we were all and yours, we were all doing public health. We didn't have public health in that title. So public health can take you anywhere, but within a local authority, obviously we have a public health team. There's public health within NHS England in terms of the screening and immunisations. Within the ICB, again, with vaccinations, immunisations, within the infection prevention control team, within universities, and within NHS trusts. I'm desperately, I'm pretty well trying to find an organisation that doesn't have a public health in it, isn't it?
But also, we've got people who've started off working locally and then gone into regional, national and international organisations.
Yes.
We have people on placements around the world who are doing public health.
Right.
So it really is like the world's your oyster.
How do I get one of those?
Well, I'll tell you afterwards. But on that, I just wanted to say as we kind of come into the end, that the team have wanted to honour your massive contribution.
Nazira's looking worried.
I'm looking very worried.
So we've got a little award which is to Nazira Vania in recognition of an outstanding contribution to public health.
Oh my goodness!
This is from the whole of the public health team. So we wanted to offer you that.
So the two people watching online can see me blushing.
And for
their benefit, I'll just kind of pose for the cameras with that.
And underneath, I've written for being a public health superstar, because that's what you are.
This is very unexpected. We'll get back to the interview in just a moment. I'm posing for a
This is
photo.
We've hijacked it, Rob.
I hijacked
Rob,
it.
thank you. But let's get back to, I even got a mashallah. That's lovely. Thank you, brother Yasir. So I'll just go back to the questions. So top tips. First steps, if a listener wants to embark on a career in public health, where do they begin?
I mean, I would start in wherever they are, because almost everything is related to public health. So start thinking where you are now about what's the relationship between what you're currently interested in and health and well-being. So it could be if people are working in the voluntary sector, then there's so much related to public health in the voluntary sector. But similar in local authorities, in the NHS, or I can't actually think of any area of work that's not in somehow related to public health. So first of all, I would think about what you're currently doing, and then start thinking about some of the specific areas that you might have an interest in. Actually, maybe go and do some volunteering. Go along to Voluntary Action Leicester. Get involved in the Community Wellbeing Champions programme, and then you'll start finding out the bits that are kind of appeal to you the most, that you want to kind of get more experience at. That can be as a volunteer, but you can also look for work. You can also, if you're a student and you're coming up to deciding what you want to do at university, you can start thinking about that at both Leicester University and De Montfort. There's a whole host of courses related to public health as well. And there's lots of people, everyone that's in public health is so enthusiastic about it that you'll never have a shortage of people to talk to and give you advice as
ready
well.
to mentor you and support you through it.
And the Faculty of Public Health as well. If you Google Faculty of Public Health, have lots of links on there for some of the practical training and information about on the training. WHO, the World Health Organization, have some loads of free courses on different aspects of health protection particularly, but loads of other things as well. And actually doing a Google public health, what is public health? How can I get into public health? There's a load of stuff. And again, the faculty have just done a new thing on careers in public health as well, which gives you some of the ways in the same way that we've just talked about.
Okay. And I will just plug the network again, actually, because of what you just said there, Rob, about students. We do actually have some students and just some individuals who want to get into public health who are on our mailing list. So again, and they've come along to like our conferences. So again, if you're listening to this and you're interested in becoming involved in public health and wanting a career in public health, you're more than welcome to join the mailing list and get those emails and learn about the events. And you can go on webinars and training and come along to our conference and start picking up some contacts and all sorts. Yeah,
just to say as well, if anyone's going to the Eid Festival at Victoria Park, is it next week? I think it is.
It will be sort of Tuesday or Wednesday.
There's going to be a stand there. There'll be a couple of people from our Live Well service doing some stop smoking advice and other things. Go along and talk to them.
And the MMR jab.
They are.
And get the MMR measles vaccination van will be there. But obviously get vaccinated if you need it, but also just go and have a chat. Go and have a chat about what they do as well.
Absolutely friendly people, and you'll be more than welcome. So we are at the end of the show. So that's all from us today and for Ramadan. If you missed anything from today's programme or previous shows, please get in touch at wellbeingchampions@leicester.gov.uk. That's the magic address. Email is there. Joel, Hamdi, myself, one of us will pick it up and get back to you. So Wellbeing Champions as one word at leicester.gov.uk. As it is the last show, I have a big list of thank yous, starting with our guest today, Rob Howard and Mary Hall. Thank you so much. And our guests over the last few weeks, so we had Amy Jones and Mark Quinnell, who did our first show, Ed Quick and Shirley MacDonald, who did our Your Poverty show, and Dr. Fahreen Danji, Maddie Winder, and Laura Hyams, who did our program last week on measles and the MMR. Massive thanks also go to the Ramadan FM team, especially Sister Mahek and brothers Akil and Yasir, who've taken really good care of us here at the studio. MashaAllah. Oh, mashallah for that. And Sister Sabiha Musa, who has been working incredibly hard behind the scenes to bring all the programming together for the month. So may Allah reward you all generously for your efforts to engage, inform and support the community. And finally, a huge thank you goes to you, our listeners. It's been an absolute pleasure being back in the studio again this year and sharing the work of public health with you.
MashaAllah.
I think everyone's getting into a party mode because Eid is approaching. So I hope you've enjoyed the program. I pray it's of benefit to you. And I wish you a blessed last week of Ramadan, a joyous Eid and good health.